you need to sort your accent out. You can't be sounding like this. You're a doctor.
Scouse accent.
Yeah.
Scousers can be doctors.
Scousers are allowed
can
to
be
be doctors,
too.
guys.
And
It's okay.
all the Scousers listening, I know I'm not actually a Scouser. I am a wall, but it's fine.
Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy.
So, hello, welcome to this episode of Coffee on Call. Today we're going to be talking about professionalism and what that means to us as doctors. So, my name is Polly. With me today, I've got Richard.
Hey.
And I've got Varun as well.
Hiya.
So, to kick this off, let's start by saying to you guys, what does professionalism mean to you? Do you want to start with me, Varun?
Yeah, professionalism is one of those that I think has a few different ways in which people are seen in the public sphere. But on the whole, it's sort of how you come across in an environment at work, basically. So for us as medics, how do the public perceive us? And it would be sort of how we would go about our work, how we present ourselves, perhaps with how we dress and, you know, how we communicate with other members, both in our team and also with the public. That's why it says professionalism.
Yeah, I think that's certainly part of it. I mean, to me, I think professionalism is one of those things you can't, if you are a professional in whatever sphere you're in, you can't really take that off or get rid of it. So, for example, if you're a doctor, you're always going to be referred to as, oh, that's Varun the doctor. Well, even if you're, you stood at the bar, one of your friends will be like, oh, that's Varun, he's one of the doctors, which is not common to all industries or occupations. So it's something that you have to bear in mind that, even outside of work, you're going to be referred to by your sort of professional...
Your title.
So, oh, that's Varun. He's you see that guy? He's very drunk. The doctor's quite drunk. That kind of thing. So it's one of those, it's a badge that sort of sticks with you. And it, as you say, it reflects what's expected of you by the public. So the public expect doctors or lawyers or dentists or vets or whatever the profession is that we're talking about to act in a certain way and with a certain level of respect with each other, but respect for the public themselves and, to be sort of trustworthy, have good integrity, that kind of stuff. It reflects all of that.
Yeah, I think you're right. I think it's a huge amount about it being an identity of your job being something that has a level of prestige and having, expectations around it, and we have to act in that way. I think one of the things that can be really interesting is how that sort of definition sort of changes as you progress through. And I don't know if you guys have any sort of experience or anything to share sort of about how you sort of viewed professionalism when you guys were students versus sort of what it means to you now that you're qualified and you're practicing as doctors.
Yeah, I definitely do see quite a big difference from that, because even when I was at medical school, our university made it quite clear that you won't be seen as the same as other students. You would be seen as a slightly different regard. If you say the term medical student, when you're talking to someone else, people expect something slightly different of you. So then it meant that if you were going to placements or you were in lectures, you were expected to turn up, be punctual, be very respectful to members of the public when you're learning, and all of these things that, might not quite be expected from your other students who are at university. And that was made quite clear to us.
Yeah. I think when you're just starting out, let's say you're a first year of your degree, I think you can sort of perceive that to be professional means you have to be kind of quite wooden and quite boring, and you can't there's no fun involved in being a professional, and that is actually completely not true. It's perfectly acceptable to laugh and joke with your patients. There are probably instances where it's not unprofessional to actually for depending on the intensity of the swear words, but I've seen loads of doctors have really good rapport with patients that might involve in saying, we're using language and things like that that's appropriate for that interaction. And it's about being able to respond and respect that patient's needs and what that patient expects of you. And it doesn't mean that you can't be funny, or it doesn't mean that you can't have fun with patients. And it doesn't mean all these sorts of things. It doesn't need, you don't need to be like an emotionless robot to be professional. And it also doesn't mean that you have to dress in a suit and look a certain way. It's about how you conduct yourself and how you treat other people. I think that's really important.
I think especially with how you've gone from being a med student to a doctor, you kind of find that role a little bit. You might find, as you say, you make a lot more jokes and you're kind of a lot more relaxed with patients, and you get into that role and you know what works for you and what works for them. And I think that just makes you more professional as you get through.
100%. I mean, some of the best doctors I've worked with, who I think have the best relationships with patients, you know, find ways to express their personality, whether that be the way they dress, the way they have their hair, tattoos, piercings. And I think professionalism is much more about sort of the way you act and the way you carry yourself, as opposed to having to limit yourself. And I know I was someone who came into medical school from a background where I didn't actually know lots of doctors, and, you know, it's been a big sort of learning journey for me going through medical school and sort of working out what that identity is. And my grandparents told me the whole way through, because you're quite old school people, you know, you can't talk like that, Polly, you're a doctor, you can't, you need to sort your accent out, you can't be sounding like this, you're a doctor.
Scouse accent.
Yeah.
Scousers can be doctors.
Scousers are allowed to be doctors,
too,
guys.
and
It's okay.
all the Scousers listening, I know I'm not actually a Scouser, I am a wall, but it's fine. And I think it's developing that idea of what professionalism is something that happens whilst you're at university. And I think one of the ways you can do that is by seeing things at work, at placement, even just sort of out and about, maybe even on social media, of other doctors, healthcare professionals, that you go, oh, actually, this isn't professional. So I was wondering if you guys have any sort of examples, or even, you know, theoretical examples of what you've maybe seen or heard about where people have been less professional at work or placement, and sort of how that's impacted sort of what you think about them, or how it's impacted sort of how they get on at work or placement and things like that.
Yeah, it's a difficult one, because I get that obviously people sort of develop their professionalism a little bit differently and maybe at different speeds. But there's definitely times when I was a student, there were people who wouldn't show up, or, you know, they wouldn't tell anyone that they weren't going to show up because they thought that maybe it wasn't worth their while at that time, or so on. And I noticed that people will sort of take note of this. They will say, okay, where has he been? He doesn't seem to have come for the last couple of days. And then they show up on their last day hoping to get a sign off or something like that. And it's also maybe slightly translated to people not coming on time as a doctor, just coming in a little bit late, 5 minutes, and then asking to sort of catch up with everything when the team's already worked together, had their huddle, and everyone knows who they are, but they're not quite sure who this person is. And I think it does sort of have that knock-on effect. And it's hard because obviously there might be reasons for why these things happen. We've got to be mindful of that as well, and maybe check in that they're okay. But it does have that knock-on effect. It makes it hard to work in that environment sometimes. Yeah.
Again, I think it all does come back to this thing of respecting each other, respecting patients. For example, I've certainly heard it when I was at medical school, where you have, let's say there's been a simulation session run or something like that, and you get a group of 6 of you there, and maybe 2 of your colleagues are maybe doing the sim, and there's 4 guys watching or 4 people watching. What you don't want to happen after that is that the group watching are kind of gossiping about what's gone on, or taking what's happened in that session away from the session, and it effectively undermining the confidence of the people who'd engaged, and I guess moving on from the kind of high school mindset of gossiping with colleagues outside of work and that sort of thing, and that translates definitely into being a doctor, where you do definitely run across instances where people kind of like maybe say a little bit too much about certain situations, or forget that actually they're human too, and they might make mistakes. And I guess it's about like reflecting that you understand you're human, you understand they're human. Would you like it if they were talking about would you like if they were talking about you the way you're talking about them? And is what you're doing actually considered if the public or your parents or their parents could hear this conversation? Is that
would
okay?
they be happy with what you said? That kind of thing.
Would you say this if they were in the room? The answer is probably no. So maybe just dial that one back and just accept that people at work are going to be under different stresses. People are going to react to different ways. They might handle situations differently to you. It doesn't make them wrong. It certainly doesn't warrant them being kind of dragged through the mud, if that makes sense, by the college. So those kind of instances are relatively commonplace, and that is, I think that's a real issue with professionalism. And it's a good place where, as a student, you can if you experience that, and you can be kind of an active bystander rather than a passive. You don't have to sit and let it all slide. You can just sort of say, well, hang on a second, like, come on, sim is not a thing that you take the mickey out of here. Let's just move past it all. Why don't you, if you've got a problem with how they've reacted, why don't you chat to them about it?
It's funny you mentioned that, actually, because something very similar did happen, in which someone actually had to have a little bit of help and support, and they were taken aside because there was a 1 or 2 people who basically were kind of not really using, or they weren't finding what the other person was saying to be helpful. So they kind of tried to demean them and push them away. And it was like, actually, in a team environment, if there was the 3 of you doing a sim session, you wouldn't do that with a third person. You would try and work as a team together. And actually, it was really good. I thought that the facilitator, who was one of the doctors, stepped in and said, actually, it's really important that you three work as a team and not treat this individual in a certain way. And I thought that was really good. But yeah.
I think what's really interesting hearing you both talk there is that, again, like we touched on a little bit towards the start of the chat, is that our views of what professionalism are much more about how a person is acting in that situation. And as you know, I worked as a teaching fellow last year, had a lot of engagement with students, and to me it didn't really sort of matter sort of what your level of knowledge was or what you were coming to the session with. It was the students who got the most out of our sessions and who were engaged with the best were people who showed up on time, people who were respectful of those around them. If you engage with the process of giving feedback and things like that, you get the most out of it. And it's exactly the same at work. You know, if you're always showing up to work on time, if you're polite to your colleagues, if you're, you know, respectful to patients, those are the people that you want to work with, who the consultants want to be like, oh, well, you know, you've shown so much interest in what I'm talking about today. Let's do a QI project together or something like that. Yeah. Whereas actually, you know, if you're showing up late, you're not engaging, you're rude to people, or you try and, you know, don't want to talk to your patients, those are the jobs where you make things harder for yourself and things are just really difficult.
Particularly the punctuality thing. If you imagine, if you've been at work for 13 hours overnight, and you can't go home until you've handed over.
Yeah.
And you're waiting for someone who's perpetually late, and your shift is getting extended 20 minutes. Your drive in the traffic is getting extended 20 minutes. You're getting into bed is getting extended by 20 minutes.
Yeah.
Then it's really, really hard to not find that incredibly offensive. Like it's really disrespectful to be late when you when you're taking your handover. Yeah. And likewise, if you're coming in for nights and someone's been at work all day and they just want to go home by that stage, by being late, you are actively delaying their departure from work.
Exactly.
And it's like everyone occasionally has a problem in their life and they have to, you know, they're going to be late. Something goes wrong. You've got a flat tire. You need to call the air. Your car breaks down, whatever it is.
Yeah.
But if you're late every
consistently
shift or most shifts and your colleagues are always waiting for you to start handover, or even worse, you miss handover, then you're making life difficult for the whole team, and that is really, really disrespectful.
And then there's an element of, like, you know, patient safety and things like that, if things get missed and so on. And I think, definitely it's something that you hope that wouldn't be an issue in any team that you end up working with. And that's why often, you know, you wish to be treated, you know, you want to treat other people as you wish to be treated yourself. You know, you wouldn't want to do that to someone else. Yeah,
and as Varun touched on, it's often really difficult to know what's going on in people's lives. And I also think that's part of professionalism as well, is sort of having the ability and confidence to sort of check on the people that you're working with as well, you know, and sort of make sure that you work out why something might be happening and escalating it appropriately and things. But definitely, I think going into work with that mindset and starting to build that mindset from early on and treating placement like work is a really good way of making that transition to when suddenly the responsibility is yours a lot easier. Yeah. And I think one of the things we touched on a little bit was sort of being able to have that personal identity outside of work, but also being aware that, you know, the notion of the doctor's really drunk in the bar does have connotations that it wouldn't have if it was, you know, the person who works in marketing is really drunk in the bar. And I think something that's worth us chatting a little bit about is how either you guys have found sort of experiencing being public facing as a doctor, or if there's anything you've seen. So I'm sure people watching will have seen people like Dr. Alex on Love Island. We've got Matty in the Big Brother house at the minute, who's a doctor. And there is an increasing rise of sort of doctors being in social media, being in the public eye, and even on a much smaller scale, just navigating it as someone who is in their 20s or 30s who has social media and has a presence. How you guys have found that as a doctor?
I mean, I guess the social media thing is a bit difficult, isn't it? Because, it's difficult. I am very careful about what I post about myself online. I'm very careful about what photographs would go of me would end up online, but I do use social media. So, for example, I like my photography outside of work, so I would post photos that I've taken of stuff, but that stuff might be like landscapes and buildings and whatnot. But what I'm not posting is photos of the last night at the pub with that, you know, with a load of empty glasses and my mate falling over. That kind of stuff is not going online. So I'm very careful about what I would put online. But on the other end of the spectrum, it could potentially have a massive upside, a massive benefit. So you mentioned Dr. Alex on Love Island, but he's raised the profile of multiple different issues within healthcare, particularly around men's mental health.
Yeah.
And actually, as a big advocate with a big audience, you potentially bring a lot of eyeballs to really important issues.
Yeah.
So if done well and deployed sort of sensitively, then medfluencers or medical social media presences could be really, really positive. But I guess there is the risk that as Uncle Ben would say, with great power comes great responsibility.
Yeah, definitely.
So if you're going to speak to hundreds of thousands or even millions of people potentially, then you need to be careful about what you say. And remember, anything put online effectively is there forever.
Yeah, and that's the thing. Actually, over the last few years, social media has really sort of taken off. So, especially when we were going through medical school and so on, it wasn't quite the same level as it is now, but now people have this access there. There is so much good that can be done. I personally have someone who I know quite well from university who has become a bit of a med influencer, and she's using a platform to do a lot of fitness related things and actually try and incorporate like sort of healthy living and healthy lifestyle and sort of running programs and that kind of thing, because that's what she does. And actually, if she has lots and lots of thousands of followers, then great, that works. However, there is something also to be said that there is also the added caveat is that these obviously have, certain profit related connotations and things that people do put on social media. They put possibly for own personal gain, profit gain, and it will go into a very influenceable demographic, like, people who are coming into medical school or maybe in the first few years of medical school. So not all of these things are true. And in fact, actually, you can often get a very fake representation of what being a doctor is like. And I think that's what sometimes I find quite difficult to see with these sort of social media.
That's not real life.
You guys think it's not real life. It's not what we've been through. Yeah.
And I think even on a much smaller scale, like I am not attempting to be an influencer and I love social media. I use social media all the time and I use it as a way to communicate with peers and friends. And I think I've recognized that, obviously my Instagram or Facebook, for instance, where it's just me talking to friends and that's all I want it for, I've kept private since I started medical school, had no intentions of doing anything else. Other platforms like Twitter, well now X, which actually can have lots of really positive sort of networking. Reddit's fairly similar. There's a big sort of medic communities on there. Actually identifying yourself as a doctor and being public can be really helpful for work as well. But you have to recognize that if you have an account that is you talking about work or you engaging with other medics, then maybe that's not the account where you post about what you got up to on your holiday or you post about those kind of things. And keeping that personal and professional identity separate, I think is good from a professionalism point of view, but also for your own sort of sanity as well. I don't need my Instagram to be being found by, patients and things like that. I want to be able to post my nice holiday pictures just for my friends and family.
I mean, one thing I'd say about a lot of the stuff you found online, unfortunately, is it tends to often the sort of algorithm, the machine, as it were, the social media machine favours things that are either controversial or negative or are going to provoke loads of engagement. And as a result, a lot of what you find online is kind of quite a negative slant on things. So it's people complaining, it's people raising possibly very important issues, but in a way that is maybe not the most constructive at times. And I kind of withdraw from that a little bit. I don't like contributing to the sort of toxic nature of what
social media
that you can sometimes find these kind of melting pots or echo chambers where there's just lots of very sort of homogenous views on the same issue, just piling on negative and vibes, as it were. And it's just not for me.
It's important to remember that these are the most vocal things that we see.
It's a vocal minority.
It's a vocal minority. There's a very silent majority of people who would consume this information but not necessarily agree with it. A lot of us who have, as we were saying, social media we see but we don't necessarily post the same amount or so on. So actually it's hard to sort of dissociate that. But if you're someone who's not from a medical background, then you will see something and actually you would think that's what all doctors think, and therefore this is representative of the profession. And that's not necessarily at all true.
The other thing worth flagging is the GMC have released modern, updated guidelines on what they expect of doctors on social media. So it is worth having a look at what what's expected, because people it would not be hard to stray away from what the GMC are expecting.
No, exactly.
You would not have to work hard to accidentally have got it wrong. So it's worth knowing what the rules are, if that makes sense.
Yeah, that's definitely true.
Recognising that those are things that apply from the second you step foot in medical school. And it is frustrating being held to a different standard sometimes, but we are, and you have to acknowledge it and just move on with it. But equally, recognizing that the reason we are held to a different standard is it's an incredibly privileged and respected profession.
Exactly.
And the public have a huge amount of trust in us.
Yeah.
And it doesn't mean that you can't have all your interests and have your own life and do whatever you sort of want to outside of work, but it's recognizing that there's a place and a way to share that.
Yeah.
And that isn't always by sharing it to everyone.
Yeah, exactly.
So I think that probably covers most of what we wanted to talk about from a professionalism point of view. So as we do with all our episodes, we've got our box. What's our sort of top tip in terms of professionalism that you'd like to give out to our listeners?
I think as you're going through medical school, my tip would probably just be, think of how you'd want to portray yourself as a doctor if, let's say, it was one of your best friend's family members who was coming in, you were the one treating them. Obviously not saying that that's exactly what would happen, but someone that, would see you as a doctor, how would you want them to visualize you and be the best version of yourself in that particular sense? And that doesn't have to be this very straight, wooden, rigid kind of, to the letter wearing a suit kind of person. It can be a very jovial, relaxed kind of person as well. But that the way in which your relationship with the patient or whoever it is appropriate, and they have trust in you. Yeah. And that your teammates can trust you as well. That's what I'd say.
Yeah. So mine's probably going to be a little bit more simple, which is, don't put something online you wouldn't show your granny. So no photos you wouldn't show granny, no swear words you wouldn't show granny.
Yeah.
Just be careful. If you wouldn't show your granny, don't put it online.
Yeah.
That's the safe barrier for me.
Yeah. And I think mine would be, you can have your personal identity, your professional identity. The best way to keep yourself sane and to maintain that professionalism is to keep those two things separate. And you will have loads of work friends, you will have loads of friends from other places, but putting that hat on when you go to work every day and getting into that routine, whether it's when I put my scrubs on, I am going to be this person, and keeping those things a little bit separate is a good way to keep yourself sane, keep yourself out of trouble from a professionalism point of view. So thank you very much, everyone.
Thanks for having me.
We'll call that the end of this episode. Thank you.
Thanks.